The first, introductory chapter explains the origins of Genjoology, noting the work of its most famous practitioners throughout history. This chapter also presents a picture of modern developments and the present situation of Genjoology. Chapter 2 discusses Jingluo. The study of Jingluo, meridians and collaterals, provides Genjoology with one of its central theoretical foundations. In this chapter, practitioners introduce the distributing ranges and main functions of the 12 Jingmai, meridians, as well as those of Renmia and Dumai. Points are discussed in chapters 3 to 5. Points are an important component part of Genjoology. These 3 chapters explain the basics of points theory, explaining the concepts of definition, classification, size, and depth, and the methods for locating a point. Using the examples of Renmai, Dumai, 3-hand yin, 3-hand yang, 3-foot yin, and 3-foot yang, the seats, major cures, and acupuncture techniques for 152 points are introduced. A review of the anatomical seating of points is also provided. Chapter 6 is the first of 2 chapters on acupuncture techniques. The chapter provides an introduction to the fundamentals of filiform needles and includes exercises on specification, inserting methods, needling practice methods, and other fundamental aspects of needle management. Precautionary advice and methods for handling and preventing unusual circumstances are also provided here. Chapter 7 is the second of our 2 chapters on acupuncture techniques. This part covers the basic uses of a range of needles, providing an introduction to the 3-edge, the cutaneous, the interdermal, the electric, and the water needles, as well as the methods of anesthesia. Clear instruction is provided in manipulations, indications, and precautions. Chapter 8 presents the concepts of moxibustion. Separate introductions are given for moxicones and strips, warm needle, naturally warmed, and spark moxibustion. Attention is also given to some non-professional or folk moxibustion techniques, noting their manipulations, reinforcements, indications, and restrictions. This chapter also includes an appendix on cupping. Chapters 9 through 12 discuss the differentiation and treatments, introducing the 3 principles for selecting Genjoology prescriptions, 5 types of commonly used clinical point matching methods, and 8 types of set point applications. The sections on differentiation introduce the pathology, classification, symptom identification, point selection, prescriptions, and manipulations for 27 illnesses for which Genjoology has a relatively high rate of cure. Among illnesses discussed are apoplexy, headache, the common cold, facial pain, and backache. Demonstrations of the processes of differentiating and treating are given by physicians. Chapter 13 provides a discussion of the differentiation and treatment of gynecological and pediatric illnesses. This chapter covers 7 gynecological illnesses, among which are irregular menstruation, dysmenorrhea, amenorrhea, uterine bleeding, and infertility. The 3 pediatric illnesses discussed are enuresis, infantile malnutrition, and their after effects. Chapter 14 introduces methods for the differentiation and treatment of 12 traumatological and dermatological illnesses. Special attention is given to windrash, furuncle, epidemic mumps, breast abscesses, acute mastitis, and herpes zoster. Chapter 15 presents methods of differentiation and treatment for 6 ophthalmological and ear, nose, throat illnesses. This chapter introduces approaches to myopia, redness, swelling, and pain of the eyes, tinnitus and deafness, sinusitis, sore throat, and toothaches. Attention is also given to the application of Genjoology to modern concerns, such as quitting smoking, narcotic rehabilitation, weight reduction, and cosmetics. Chapter 16 explains the distributing ranges and intersections of the 8 extra meridians with the 12 Jingluo. Those interested in understanding the distribution, range, and function of the meridians, their clinical significance, and the illnesses which require their understanding for healing should be certain to carefully study Chapter 16. Chapter 17 introduces Qi-Shi and Qi-Hai. Qi-Shi and Qi-Hai are the common clinical basis for treating 2 illnesses simultaneously. The discussion is conducted in the context of differentiating and treating shaking, paralysis, hyperplasia of the mammary glands, heart pains or heart numbness, and side pains. Chapter 18 provides a fourth chapter on points. In this chapter, 64 additional commonly used points are introduced, bringing the total number of points discussed up to 216. This fourth discussion fulfills the demands for instruction in points as outlined by international genjoologists working in Beijing and provides the working knowledge of point location that all practitioners should have. Chapter 19 introduces matters of prudence relating to points and anatomy. Clinical acupuncture work must keep afoot of a number of important matters relating to anatomy. Prudence in this respect is crucial. This chapter provides instruction in anatomy as it relates to needle insertion, point specification, insertion angles, and insertion depths. Chapter 20 presents classical needling methods. Here a presentation is given of opposing views concerning various aspects of the art of genjoology as held by physicians throughout history. A discussion of acupuncture techniques not commonly known accompanies this historical chapter. Chapter 21 is concerned with methods of acupuncture known as reinforcing and reducing. Genjo's clinical curative effect is clearly related to a precise differentiation of illness and a delicate identification of points. Only after considerable research and instruction in the methods of reinforcing and reducing will one have a clear understanding of how to turn apparent crisis situations or severe and lingering illnesses into matters easily resolved. Chapter 22 covers a diagnosis and treatment of auricular points. The auricle region reacts to all of the body's organs. This chapter presents the process of clinical observation by visual and manual observation and by electrical calculation, as well as auricle point diagnosis. These presentations are accompanied by a discussion of various auricle point treatments in use by doctors in a wide range of countries. Chapter 23 discusses eye acupuncture. Acupuncture for eye treatment was first carried out by Professor Peng Jingshang. He had developed his methods on the foundations for the art of healing vision problems as set down by the Han Dynasty physician Hua Tuo. Acupuncture divides the eye into 8 regions, identifying 13 points for use in treatment. The methods are easily implemented and bring quick results. Chapter 24 introduces the method of 3 needles, commonly used for puncting into the temporal and around diseased areas. A presentation is given of the method of 3 needles as it has been developed by Professor Jin Rei for treating apoplexy and sequelae. This puts this method's curative process on display and discusses the indications for applying this method to the tongue, shoulder, and knee. The latter part introduces CT fixed position and closing acupuncture, noting manipulations and precautions. Chapter 25 presents the treatment of apoplexy by means of the Xing Nao Kai Qiu method. The surpassed work of Professor Shi Zhongmei in this field has developed into its own school of thought. Professor Shi's work is precise, smooth, dynamic, and fluid. Over the past 16 years, he has successfully treated an untold number of cases of paralysis using his Xing Nao Kai Qiu method. His work shows a 57.8% healing rate for a total count of 3,207 cases. Chapter 26 discusses warming needle treatment and the use of moxibustion over medicinal caking. This chapter introduces Professor Gao Zhenwu, who gives a presentation of his work in both warming needle treatment and moxibustion over medical caking. Emphases are placed on clinical diagnosis and application, manipulations, and precautions. Chapter 27 covers points application therapy. This is a healing method which requires the application of medicines to fix points, combining acupuncture and moxibustion treatment. This chapter shows methods of diagnosis and factors directing the selection of medicines, as well as manipulations, the process of healing, and precautions. Applications for asthma, sinusitis, and yang-deficient Qi illnesses are also explained. Chapters 28 through 30 conclude the series. They cover treatment of shoulder B syndrome and medulla oblongata pseudoplegia, rheumatoid arthritis, and palpitation and obstruction of the heart, respectively. These illnesses are all commonly encountered in clinical practice, but their treatment is generally quite difficult. Still, treating these illnesses with Zhenjiu produces unique healing effects, as their symptoms are responsive to this form of treatment. These 3 chapters provide separate introductions to Chinese medicine's particular classifications and handling of these illnesses and to the characteristic methods of Chinese medicine put to use in their healing. This 30-chapter instructional cassette series of China Zhenzuology has a total playing time of over 1,300 minutes. There are both Chinese and English language editions of its accompanying text of the same title, published by NTSC and PAL Systems. The China Zhenzuology series provides those who wish to undertake independent study in this field with an ideal introductory guide. The series is also essential study material for medical students planning to participate in the International Examination of Acupuncture and Moxibustion. Professors of acupuncture will also find the series an ideal teaching aid.